Bulimia nervosa is a clinically recognized eating disorder that affects both psychological and physical health. It is characterized by a recurring cycle of disordered eating behaviors and compensatory behaviors intended to counteract food intake. This condition is classified as a mental health disorder, not a lifestyle choice or dietary preference. Bulimia typically involves a repeating cycle with two main parts. The first part involves episodes where a person consumes a larger amount of food than they feel they can control within a short period of time. The second part involves behaviors intended to reduce or counterbalance the perceived effects of that intake. These patterns tend to repeat over time and can become reinforced through both psychological and physiological mechanisms. Bulimia is strongly associated with psychological factors. Common features include preoccupation with body weight, shape, or food, as well as difficulties with emotional regulation. Many individuals also experience co-occurring conditions such as anxiety disorders, depressive symptoms, or obsessive thought patterns. The behavior cycle is often maintained through reinforcement, where temporary relief is followed by distress, which then contributes to repetition of the cycle. Bulimia can have significant effects on multiple body systems over time. These may include disruptions in electrolyte balance, gastrointestinal complications, dental erosion, cardiovascular strain, and general fatigue. Some effects may not be immediately visible, but they can still develop internally with repeated behavior patterns. The severity and presentation of symptoms can vary depending on frequency and duration. From a clinical standpoint, bulimia is considered a complex disorder involving both behavioral and neuropsychological components. It is not solely related to food intake, but rather to how the brain processes reward, stress, and control mechanisms. Treatment approaches in medical settings typically involve psychological therapy, nutritional rehabilitation, and medical monitoring, depending on severity. Bulimia nervosa is a medically defined eating disorder with both physical and psychological dimensions. Understanding its mechanisms is important for recognizing how it develops, persists, and affects the body and mind.